But let's talk about Saint Giles Hospital first.
Okay.
A medical facility that is there for many, many years as a psychiatric hospital. And now with the new emerging challenges where they're also flooded, bursting at the seams, also handling drugs cases. What's happening at that hospital?
Okay. So it's already known that the challenges that Saint Giles is having. I mean, it's infrastructure, it's overflowing patients, and if you talk to them, they'll tell you their patients are getting younger and younger, and they're coming in with already high on drugs and things like that. One of the things that we have seen and we're finding a bit puzzling is when you look at the budget allocation for Saint Giles Hospital. Remember, this is our only mental health hospital in the country. What we found interesting was in the 2023-2024 budget, we noticed that they had a reduction in basic operations. So electricity, food, that sort of stuff, and that didn't make sense to us because this is a hospital that's bursting at its seams, yet was being defunded, and we still don't really understand why. What we are worried about is, and don't get me wrong, HIV is definitely something to be concerned about, the rise in HIV cases. But I think we need to be careful because we're linking a lot of the spikes in HIV to the drug crisis. But I think we just need to take a step back and just think about it a little bit more systematically and prioritize. When you have a drug crisis, the first issue to be affected will be mental health. Definitely HIV, but mental health. And the other reason why we are highlighting mental health is because if you have HIV, there's drugs to treat it. If you are addicted to meth in Fiji, you're on your own. We have nothing. So we need to start really, not just talking about it, but doing something about our ways to address addicts. Because if we don't do that, Fiji is going to turn into the next Chicago.
The issue is, and that's quite scary, the issue is that we are there already.
We're there.
We're bursting at the seams in terms of patients coming in, a mental health hospital trying to deal with it. We don't have an established drug rehab center.
Correct.
How dangerous is that when we don't have a drug rehab center now and we're getting cases of meth, drugs every day?
Yeah, exactly. So we'll be getting, the way we're going right now, we're going to have drug users with HIV who are being treated, but they'll end up at St. Giles with a mental health issue which can't be treated. And like you said, the button for emergency has already been pressed, but it's now time to start doing